Hello, so in this presentation I'm going to discuss how gold nanoparticles could be used as cancer treatment and for imaging of tumors. So firstly I'm going to talk about photothermal therapy, which is a minimally invasive cancer treatment that uses near-infrared light to heat and destroy tumor cells. If sustained local temperature increases above 41 degrees C can be achieved, cells in the local region will be killed. The timescale for cell death drops significantly with increasing temperature. It is a promising treatment because it offers high spatial precision and fewer side effects than chemotherapy, and has a high potential for repeat treatments. In this figure, you can see the molar absorbance of various common compounds found inside the body and alongside the absorbance of water. What can be seen is there is a large gap between the various peaks in the window, around between 650 nanometers and 950 nanometers, where there is very little absorbance of light. This is known as the first near-infrared biological window. So the net result of this is that we see a dramatic increase in the penetration depth of light into human tissue in the first near-infrared biological window. In this region, the penetration depth of light goes from around a few millimeters to several centimeters. Hence, photothermal conversion agents that absorb strongly at these wavelengths can produce heat in vivo, creating localized heating without significant heat generation along the light path. So where do gold nanoparticles come into this? Gold nanomaterials exhibit localized surface plasma resonance, a collective oscillation of electrons when excited by light that is dependent on the particle shape. The absorbed light is then dissipated by heat generation with near 100% efficiency. We can synthesize a range of gold nanoparticle morphologies with tunable absorbance peaks throughout the visible infrared. In the example shown, parameters such as aspect ratio in the case of gold nanorods, shell thickness in the case of gold nanoshells, aspect ratio again in the case of nanobipyramids, and edge length in the case of nanocages, spike length in the case of nanourchins, and edge length can be controlled during synthesis and used to control the position of absorbance peaks, allowing them to be tuned well into the infrared. We can treat cancerous cells with near-infrared absorbent gold nanoparticles and observe their uptake into cytosomes within the cell. And it can be observed that these particles do not impact the viability of the cells unless they're exposed to both laser light and gold nanoparticles. And the rate of death also increases with increasing exposure time to the laser. There have been a number of studies demonstrating that gold nanoparticles can be used to generate heat within a tumor in vivo using mouse models. Irradiation of nanoparticle-treated tumors has been shown to generate heat locally at a much higher rate compared to controls, and they retard tumor growth after treatment. And there have even been human trials, which have been taken in the US, using gold nanoshells, which have shown a significant reduction in tumor size with photothermal therapy. So one photothermal application of gold nanoparticles is imaging. If a laser with a very short pulse width is used, of the order of several nanoseconds, then heat generation can be extremely localized to within a few nanometers of the gold nanoparticle. And this occurs so rapidly that the thermal expansion cannot occur, leading to a localized buildup of stress, which is then released as an acoustic pulse around 1 microsecond wide. This pulse can then be measured using multiple transducers and then using time of flight calculations localized in space. And the distribution of photoacoustic methods can then be recreated in space. For instance, in the image shown here, the localization of gold nanotubes within a tumor and the side of a mouse can be seen inside the yellow circle. So there are a number of challenges remaining that prevent this technique from advancing. I want to highlight 3. Firstly, it's very hard to get particles to accumulate in tumors in vivo. The body's immune system treats nanoparticles as a threat, leading to evacuation via the liver and kidneys, as shown here, where the vast majority of gold nanoparticles are found in the liver and spleen at all time points after intravenous treatment with gold nanorods, with minimal uptake into the tumor. Secondly, functionalizing the particle with an active target molecule, such as antibodies, has not yet proven reliably successful. A meta-review from 2016 found that the median uptake of tumors of many nanoparticle-based studies across 10 years was 0.7% of the injected dose, and this did not change over the course of the 10-year period, indicating that we're still not making progress on active targeting. Thirdly, when exposed to biological fluids, many nanoparticles aggregate. This is disastrous for gold nanoparticles because they lose their plasmonic properties when they form large aggregates. Strategies have been developed to address this, but it puts limits on the range of surface functionalizations that are possible in vivo. So, in summary, Near-infrared absorbent gold nanoparticles offer a promising approach to treat and image cancer, but there are major challenges to overcome before any transition towards the clinic is possible.